Hello and welcome back to my YouTube channel. The purpose of this video is to teach you how to get the most out of your hormone testing. And in getting the most out of your hormone testing, this is going to save you time, energy, money, and quite possibly a good amount of frustration. As a practicing doctor, I can tell you that I have seen dozens, if not hundreds of women come into my practice who've been given erroneous information as a result of improperly timed or applied hormone testing. I've had young women who are told that they're infertile. I've had middle reproductive age women told that they are entering menopause. And I've had other women told that they've got polycystic ovarian syndrome, all of which were incorrect diagnoses. So if you stick with me through this video, you're going to learn the two important points that I use with all of my patients that help to optimize their hormone testing. And those two important points are: one, first correlate the clinical symptoms and the clinical reproductive time frame. The second is to understand a normal menstrual cycle, because we need to be doing the hormone testing in conjunction with a certain time of the cycle. My name's Scott Resnick. I'm a physician, and I'm making these videos because I want to give you the tools, the tips, and the techniques to really take charge of your health, to be your own best health and wellness advocate. So to understand the optimal use of hormone testing, what I want to do is have you begin to look at a woman's reproductive years in three different states. The first state of a woman's reproductive years is characterized by her post-pubertal years, and typically this is ages between maybe 13 and 16. Basically, in this age group, the norm is abnormal. So if a young woman is having a cycle maybe every 3 weeks or every 3 months, that's not necessarily abnormal, because what's happening is it's taking the body some time to try to put together all of these different hormonal systems that include the hypothalamus, the pituitary, the thyroid gland, the adrenal glands, and finally the ovaries. If a young girl is not in significant pain or having pretty pronounced anemia as a result of these abnormal cycles, I tend not to do anything at all. The one caveat to this are the young women who are really early on struggling with a polycystic ovarian syndrome type presentation. These young women are typically characterized by a lot of hair growth on the side of the face, over the upper lip, chin, around nipples, or in the pubic area. And the reason why I would want to do hormone testing, primarily measuring testosterone and DHEA in this young age group, is because if this is a true diagnosis, this does sort of portend an early diabetes, and I want to begin to work with the parents and the child on this earlier rather than later, for the obvious reasons. The next clinical group that I want you to look at are the women who are in sort of the prime reproductive years. And these are probably ages maybe 17, 18 to maybe the early 30s. What I do with this group of patients is first ask the clinical question of whether they're having what's known as muliminal signs. Now, a muliminal sign is a sign that a woman has undergone a good ovulatory cycle. And these are typically signs like breast tenderness, poochiness, weight gain, moodiness, and oftentimes I'll see food cravings, such as the woman who comes in and says, "Doc, right before my cycle, I am craving peanut butter or chocolate." Typically, these clinical signs show that a woman has had a normal ovulatory cycle. The third group of patients that I want to look at are women in the later reproductive years. And these are the ages of maybe like 29, 32 to the mid-40s and really going up to menopause. To understand the changes that take place primarily in this latter group, it's important to understand a normal menstrual cycle, and that's what I want to go over next. So a typical menstrual cycle, and what we'll use for descriptive purposes in this video, is a 28-day cycle. That means from the start of one period to the start of the next period, is 28 days. Know that a woman can have a 24-day interval between cycles or a 32-day interval between cycles, which is considered normal if they're ovulatory and having muliminal signs. What happens is, in a very reproductively able woman, a woman who's ovulating well, we see this. In the first half of the cycle, we see progesterone very, very low, and we see a bump or a rise in estrogen. Then at mid-cycle, we see ovulation. In the second half of the cycle, in a woman who is ovulating well, we tend to see a second rise of estrogen, but also a rise of progesterone. Now, in the prime reproductive years, what I will typically do in this age group is simply check a blood test, measuring estrogen and progesterone, and if I'm worried about polycystic ovarian syndrome, I will add on testosterone and DHEA. In this age group, with serum testing, if a woman has a progesterone level greater than 5, she's probably ovulatory. If she has a progesterone level in the second half of the cycle that's in the 12 or 17 range, she's probably ovulating very well. And what I typically do is I want to measure hormones in that second half of the cycle when I expect the peak of progesterone. So what I will instruct patients to do is to do their blood work on days 18 to 20 of the cycle. This is one of the most important things that I can share with you in this video, because it's the women who had their blood work done mid-cycle, in the first half of the cycle, with kind of like a willy-nilly approach to thinking about the normal physiology, who presented to me with all those concerns that I mentioned in the first part of this video. In the last group of women who are in those late reproductive years, remember, you can still get pregnant, but what happens is that the capacity of the ovaries is diminished. The egg quality isn't quite as good. The ability to ovulate isn't quite as good. And what we tend to see is we see sort of a more suppressed rise of progesterone in the second half of the cycle. But remember that the estrogen rose normally. So what we begin to see is then what we call a estrogen to progesterone imbalance, or estrogen dominance. Clinically, this is associated with a number of symptoms that I'm going to go over with you right now. A woman who is in a state of estrogen dominance will typically notice weight gain. She'll notice poochiness and water weight, but she'll also come to me with complaints of pretty significant mood changes, not the least of which are depression, a more pronounced premenstrual syndrome, and often a really strong degree of anxiety, nervousness, and insomnia, which is typically characterized in the second half of that cycle. The beauty of understanding this is that one of the safest and most effective interventions that I can use in that patient population is to give her luteal phase, or second half of the cycle, progesterone, to begin to augment that suppressed second half of the cycle progesterone up to a more normal or physiological level. I can't tell you how many women I've seen in my clinical practice who've had all those symptoms that I just mentioned practically disappear when we replace their progesterone in the second half of the cycle. There was one more thing I want to mention, and that is that in this latter group of women, the women in their later reproductive years, we can do laboratory testing by getting blood out of the arm. Again, a progesterone level less than 5 reflects a woman who probably didn't ovulate that well that cycle. However, in this group is when I tend to use more tests from some of the specialty labs that use either salivary or my preference, which is blood spot testing, because these labs will give us a ratio between the estrogen and the progesterone. And not uncommonly, in this age group, particularly if it's associated with symptoms, I see a state of estrogen dominance or progesterone deficiency. Once again, to recap, we look at women in 3 different age groups. One is the early reproductive years, one is kind of like the money reproductive years when women are most fertile, and then the third group is that latter set of years. If you're in any of those groups and you've got muliminal signs and predictable cycles, you're normal. I don't think there's any reason to measure any laboratory tests. You're going to save you money, time, and possibly frustration as well. As women get into their later reproductive years, I start to see a state of estrogen dominance. And this is when I start to think that we can really see the benefit of using some of these specialty labs that will show us a ratio between estrogen and progesterone and let us know the degree of estrogen dominance. I hope that this video was helpful for you. And of course, this is YouTube, so if you like the video, like, comment, subscribe, and most importantly, share it with your friends. Either way, I will see you next week in another video, and be well.